and how we can help in these areas. So as we continue on forward, that's kind of the gist of what I personally would hope for this task force. And I was going to pass it to Senator Howell. He's running a little behind, but if anyone would like to go next, Representative Weber, if you would, that'd be great. Thank you.
Good morning. State Representative Russell Weber, House District 26, Hardin and Bullitt counties. Several years ago, I was a member of the Public Assistance Reform Task Force. And during that task force, one of the areas we discussed was the benefits cliff. I think this is an important area. I work closely in the area of workforce development and the issues that are confronting us in the state related to that area. And I see us working on the benefits cliff to encourage folks for reentry into the workforce and kind of serving as a bridge to help individuals enter the workforce or remain in the workforce and be able to advance in that. So I look forward to the work that this task force will undertake. Thank you, Mr. Chairman.
Thank you, Representative Weber. Senator Nemes?
Yes, I'm Senator Mike Nemes from Bullitt County and Southern Jefferson County, District 38, and I can't say it any better than the chairman has. But I've worked in the labor cabinet, and the workforce is a big thing with me, so I'm interested in this. Thank you.
Thanks, Senator Nemes. Representative Stevenson?
I'm Representative Pamela Stevenson. I serve District 43 in Jefferson County. And my desire for this is that we be the people that we say we are, and every family thrives. And I don't know what that looks like, but I know that we have the power to make sure that people get what they need to be the people that they're called to be.
Thank you, Representative. Representative Bray, just introduce yourself and just a brief explanation on kind of some goals and views of the task force.
Thank you. So Representative Josh Bray, 71st District. So I guess my goal is just to kind of explore kind of what's holding some people back from doing better. I know this past weekend I talked with a gentleman who wasn't from my district. He's got a $2,000 pharmacy benefit, and so he's had opportunity to work more hours or to get a higher paying job, get married, that kind of thing. Couldn't do it because if his income goes up, he loses that benefit. So government is effectively holding him back. And so I do think that this is a good topic to explore and look forward to it.
Thank you, Representative Bray. And with that, we'll go ahead and dive into our agenda. We're good to have NCSL present to present to us. Heather, if you would like to introduce yourself, they are via Zoom, and your colleagues, we'd appreciate it, and you may proceed.
Thank you so much, Co-Chair Dixon, and hopefully Co-Chair Howell will be able to join us soon. Good morning, and thank you, members of the special committee, for inviting in NCSL to present. We appreciate your time and engagement. My name is Heather Wilson, and I'm a senior policy specialist with the National Conference of State Legislatures. My work focuses primarily on economic and housing policy as it intersects with child and family well-being. I'm joined by my colleague, Cameron Rifkin, who will introduce himself.
Hi, everyone. Good morning. Thank you all for being here, and thank you for the opportunity for us to speak. As Heather mentioned, my name is Cameron Rifkin. I'm a policy associate with the Children and Families Program. I work predominantly on housing and homelessness, economic mobility, and some additional intersecting policy topic areas. And thank you, Heather.
Before we begin our presentation, I'd like to share with you some information about the National Conference of State Legislatures, or NCSL. NCSL is the country's most trusted bipartisan organization serving legislators and legislative staff for nearly 40 years. We are nonpartisan and policy neutral at the state level. We promote policy innovation, create opportunities for lawmakers to share knowledge, and ensure state legislatures have a strong, cohesive voice in the federal system. We do this because we believe in the importance of the legislative institution and know when states are strong, our nation is strong. NCSL is the only organization serving all 7,383 legislators and more than 25,000 legislative staff, serving all 50 states, territories, and the District of Columbia. Our services include research, connections, training, a state voice in DC, and meetings. During today's presentation, we will provide an overview and examples of benefits cliffs and public benefits, discuss state policy opportunities and options, and share key takeaways and resources for continued support to meet the committee's needs. We will have time for questions following our presentation. What are benefit cliffs? Before we dive into a benefit cliff overview, I would like to share a national snapshot of what poverty looks like across the nation and the number of people using public benefits at 100% of the federal poverty level. While this data is from 2020, it is the most recent available through the US Census Bureau. In 2020, 11.4% of the nation's population was living below the poverty line. This number increased slightly from 2019, according to the official poverty measure used by the Census Bureau. It was the first increase after 5 years of decline. The highest increase was seen for children under the age of 18, increasing from the rate of 14.4% in 2019 to 16.1% in 2020. On average, poverty in Kentucky during this time from 2018 to 2020, a 3-year average from the Census Bureau, was higher than the national percentage, with 14.4% of all Kentuckians living in poverty. Nationally, 7.3 million primary families, or a group of 2 or more people, one of whom is the householder related by birth or marriage or adoption and residing together, so representing nearly 25 million people, were living below the poverty line. Of those primary families, over half of them had at least one person who was employed, and women were 4.5 times more likely to head primary family households living in poverty than men. Nearly 1/4 of the population ages 25 and older without a high school degree lived in poverty, and workers in the service industry were more likely to live in poverty than workers from other occupations. When you look at the public benefit participation, in 2020, those below 100% of the federal poverty line, so $13,171 annually for an individual under the age of 65 and $26,496 for a family of 4. You can see how many people were actually using each of our assistance benefits. And the first number, the 27.9 million people, does include school lunch reductions and free lunch. So the Census Bureau does provide this statistic up to 200% of the federal poverty line. The value of work has been well documented. The National Academy of Sciences has found that increases in steady employment, wage rates, and earnings as among the strongest correlates of escaping poverty and moving into financial independence. Work is correlated to increased happiness and better health outcomes. Work also provides opportunities to build strong and lasting relationships, which is a protective factor against child abuse. Later on, my colleague will share an overview of federal public benefits, but now I'm going to jump into the work of the task force and provide an overview of benefit cliffs. People face benefit cliffs, also known as the cliff effect, when they receive public benefits from the government, have an increase in overall income, and then discover they make too much money to receive the benefits, but they are not making enough money to sustain themselves and their households. As a result, families do not have the resources required to meet even basic needs, and employers are stymied in their attempts to hire and promote employees. These unintended misalignments confound parents seeking sustainable employment and the state agencies striving to assist families. The next couple of slides will illustrate both the cliff effect and the cliff plateaus faced by families. The individual in this example from Marion County, Indiana, is a single parent with one preschooler and one child in school, with wages starting at $8 an hour and increasing to $24 an hour. The red line across the middle demonstrates the point at which income equals the cost of basic necessities. The parent experiences 3 cliffs in this example, with the most dramatic cliff coming with a wage increase of 50 cents from $15 an hour to $15.50 an hour. The total impact is a 25% decrease in annual net resources, dipping well below the break-even line. This example from Maine is of a worker with 2 children who moves from a part-time or half-time job making $10 an hour to a full-time job making $20 an hour as a licensed practical nurse, and receives all benefits for which she is eligible. She would see a wage increase of $2,500 a month, reduced to $1,100 net increase in economic resources because of corresponding reductions in public benefits. In this case, the family plateaus before becoming economically sufficient. Workers and their families realize far less overall economic benefit when wages are in the $13 to $20 an hour range in Maine, exactly what so many middle-skilled jobs pay in Maine. Only above $25 an hour are workers in Maine able to become self-sufficient. While this wage differs from state to state, nationally, many people experience benefits cliffs between $13 and $17 per hour. The interplay of public benefits and policies across agencies and between levels of government have the unintended consequences of limiting economic growth and disincentivizing work. I will now turn it over to my colleague Cameron to share a bit more.
Thank you, Heather. We will examine what the benefits cliffs look like across various public assistance programs. Benefits cliffs and public assistance programs have some interconnection, and we'll kind of explore that over the next few slides. Here, these are the federal eligibility guidelines for public benefits. These 5 are some of the most used public benefits. So low-income families often need these assistant benefits in addition to earned income to help make ends meet. And we have housing assistance, energy subsidies, nutrition assistance, cash transfers, and health insurance. And so for housing assistance, we have vouchers, sometimes referred to as Section 8. These help pay for rent. Low-income home energy assistance program that provides for financial assistance for utility bills, weatherization, and energy-related home repairs. Supplemental nutrition assistance program, that's SNAP. Many of you may be familiar with that. That's the largest federal nutrition assistance program. This provides benefits to eligible low-income individuals through the electronic benefits transfer card. For cash transfers, TANF, the Temporary Assistance for Needy Families program. This provides grant funds to states and territories to provide families with financial assistance and supportive services. This helps folks achieve economic self-sufficiency. They provide assistance with childcare, job placement, employment, interviews. A lot of different supportive services come through TANF. So health insurance, Medicaid, I'm sure many of you are familiar with that. Medicaid is a joint federal and state program that, together with the Children's Health Insurance Program, provides health coverage to about 73 million Americans, including children, parents, seniors, women, pregnant women, folks with disabilities. Medicaid is the single largest source of health coverage in the United States. Not noted on this slide is childcare and development assistance. We'll dig a little bit deeper into that in just a little bit, but must be a parent or caregiver of a child under the age of 13 or 19 years old if the individual is unable to live independently. It is restricted to those in low or very low income households, and these requirements vary by state regarding employment or enrollment in an education or training program. So we just mentioned a few. We have TANF, SNAP, WIC, and the Child Care Assistance Program, otherwise known as CCAP. So how the benefits cliffs kind of presents itself across these programs might differ. For SNAP, exceeding the income limit threshold by as little as $1 can result in a total loss of SNAP benefits. For CCAP, according to research done by the National Women's Law Center, a family of 3 in 2020, making 150% of the federal poverty level, which was about $32,000, would not qualify that family for child care assistance in 13 states due to income limitations. Next slide, please. Thank you, Heather. And this is a Montana case study. This came directly from the Montana legislator and the state's Economic Affairs Interim Committee that examined the benefits cliff. So much like this task force here, this was a very similar committee responsible for exploring everything related to benefits cliffs. In this study, we have Cassie, a single mom raising a 3-year-old son. She is currently earning $11 per hour and working full-time, which is about $22,800 a year. She does not receive health insurance through her employer, and she's offered a promotion that would require her to work on weekends, but it would increase her pay to $16 an hour with no overtime. This would be an increase to about $33,000 or about $867 per month. And so the Montana committee wanted to explore how this promotion would affect Cassie's benefits. The federal poverty level for a 2-person household in 2021 was $17,420. She's currently at about 131% of the FPL, the federal poverty level. If she accepts this promotion, she will be at 191%. So currently, her and her son qualify for Medicaid, SNAP, WIC, the Low-Income Energy Assistance Program, and CCAP, the child care assistance. If she accepts her promotion, she will no longer be eligible for Medicaid or WIC. Her son, however, would be eligible through a state program in Montana called the Healthy Montana Kids program. It's free or reduced health care insurance for families that don't qualify for Medicaid. It is only eligible to her son and not to Cassie. Her sliding scale childcare costs would increase $418 a month if she were to accept her promotion. Sliding scale costs are dependent on the family's income. She would also have to locate a babysitter or childcare service on the weekends because her current place is not open on the weekends. And as we mentioned, the promotion would require some weekend work. Her SNAP benefits might also be terminated, as well as her energy assistance benefits. We mentioned SNAP benefits could be terminated if her deductions decrease her net income to 100% of the federal poverty level. And the energy assistance, she's very close to the threshold. The threshold for her household would be about $34,000, $35,000. And with her current income, she could not accept any other really additional income, child support payments, another job, a gig job, perhaps. So ultimately, Cassie's promotion could result in a net loss of income due to healthcare costs, childcare costs, and benefits loss, resulting in what Heather had mentioned, what many refer to as a benefits cliff. Part of this complicated benefits cliff is work requirements, and work requirements vary by state. They can be mandatory or voluntary. They can include requirements to work a certain number of hours or be searching for employment for a certain number of hours in order to receive public assistance benefits. There are exemptions, caring for a young child, having a disability, being enrolled in a school or training program. That last category does have additional criteria and restrictions as well. With work requirements, during the Reagan as well as the Clinton administrations, research was dedicated to focusing on the effects of benefits cliffs and work requirements. We've seen a shift more towards nonprofit organizations and bipartisan think tanks exploring this topic. The data suggests mixed results in terms of efficacy. Some have shown, no real clear increase in employment or reduction in poverty. Some recent studies show that work requirements can create red tape barriers and these complexities that result in benefits loss for eligible families. So for families that would otherwise receive benefits cliffs. Next slide, please. We are going to dig a little bit deeper into state options and some examples, legislation and strategies that policymakers can use. Benefits cliffs can be complex, and there are a variety of ways that we can mitigate them. There isn't a one size fits all. So in 2019, NCSL partnered with the Administration for Child and Families on a 2-generation initiative. It was called the Whole Family Approach to Jobs, Helping Parents Work and Children Thrive. This program worked with several states in the New England area and brought together public and private sector stakeholders from workforce development, human services, early childhood, and several other policy areas to help state leaders develop program, policy, and system solutions to help parents achieve greater economic stability, particularly through employment and caring for children. This coalition identified 5 overarching state policy strategies to consider, and we'll talk a little bit more about this. Mapping benefits cliffs, that's what we're doing here. You all are doing here, the committee, the task force, developing benefits calculators, exploring self-sufficiency standards, aligning eligibility levels includes aligning application processes, streamlining the process, adjusting asset limits, a variety of different things can kind of go in there. Making work pay, that's what we referred to as a few different tax credits we'll talk a little bit more about, as well as cultivating career pathways. Increasing family economic security and fostering system changes. For increasing family security, that includes escrow accounts or individual development accounts. Fostering system changes includes educating employers on the benefits cliffs and why their employees might not accept a promotion, as well as increasing student access to SNAP. NCSL maintains a variety of databases. We do maintain an economic mobility database that tracks enacted legislation from all 50 states, as well as the territories and the District of Columbia. We'll be sharing some resources with you all a little bit later. So here we have a few examples of enacted state legislation. Colorado recently implemented a work management system across their counties to interface with the state's benefit system. Louisiana passed a resolution requesting a study and recommendations to the legislator concerning eliminating benefits cliffs in public assistance programs, and Maine eliminated the asset test requirement for their SNAP recipients. Maine also created the Essential Workforce Advisory Committee, required to recommend and develop a pilot project to mitigate the benefits cliffs effects. Nebraska increased the gross income eligibility limit and the asset cap requirement for SNAP, expanding access to that benefits program. And Texas created a self-sufficiency fund used by public community and technical colleges, as well as community-based organizations, to provide job training to folks at risk of facing a benefits cliff or becoming dependent upon public assistance benefits. I would also, obviously like to acknowledge the legislation here in Kentucky that created the task force, as well as the development of a benefits cliff calculator. We have seen state policymakers continue to explore this with some pending and or failed legislation. Iowa introduced legislation to create an economic opportunity work group. This bill failed to pass. Massachusetts currently has a pair of bills pending to create a pilot program addressing the reduction in public supports when earnings increase, and Ohio has a pending legislation dedicated to public assistance benefits cliff study committee. So we do continue to see various states exploring this issue of benefits cliffs. Next slide, please. Oh, thank you. We mentioned briefly some tax credits. This was pulled from pages that NCSL maintains. These are our earned income tax credits pages and our child tax credit pages. And so on the left, we have the EITCs, and on the right, we have the child tax credits. So for EITCs, 33 states, the District of Columbia, Guam, and Puerto Rico, as well as some municipalities, have state level or territory, district level earned income tax laws. For child tax credits, 12 states have child tax credits, 9 of which are refundable. And we have seen a lot of momentum around child tax credits. 6 of these states have enacted these in just the last year or so. And we are continuing to see more legislation geared towards tax credits, as we mentioned, making work pay and providing some resources to working families. Would like to note that Washington is the only state that has an earned income tax credit, but they don't have a state income tax. So what they do is have a flat dollar amount dependent on the number of children in the household. And that will go into effect for Washington, I believe, next year, beginning in 2023. With that, I would like to pass it back to my colleague, Heather, who will close us out. Thank you all, and thank you, Heather.
Thank you, Cameron. Some key takeaways from this presentation are that public assistance benefits impact employees and employers, and sometimes creates a disincentive to work or advance in a job. Small increases in wages may reduce overall family financial resources due to a loss of benefits. Benefits cliffs can negatively impact a family's economic security and mobility and extend their reliance on benefits. States have options with public assistance programs to streamline, or reduce cliff effects. So the next couple of slides are just some links to resources that we have compiled for the committee's use related to the cliff effect. The first slide covers NCSL resources, including some of the databases that Cameron shared. And the next slide are resources from other organizations outside of NCSL. Both my and Cameron's contact information is shared for any additional or new research questions you may have as you look into benefits cliffs, or if you would like us to come back and present on a related issue. As a reminder to members, NCSL's largest event, the Legislative Summit, is coming up August 1st through 3rd. There is still time to register and attend. The HHS track will have a session on family tax credits. Representatives from Colorado and Oklahoma will be present, and that may be of interest to members of this task force. We have also included some definitions around measures and key terms for your quick reference. With that, I'm going to stop sharing my screen and return this to the co-chairs, Dixon and Howe, to see if you have any questions.
Thank you, Ms. Wilson. Does any of the members have any questions for Senator Wheeler?
Thank you for the presentation, and very informative. I guess one question I have is when you're crafting these types of programs to, in my mind, ease people back into work, which I think is a very valuable thing. I can recall last session with some of the legislation that was considered regarding unemployment that you were unable to use like a regional jobless rate and a regional poverty rate to maybe craft a finer tuned solution to deal with different areas experiencing different problems as far as available jobs. When you're dealing with these federal programs like Medicaid and SNAP and WIC and these types of things, Do the federal guidelines allow legislators when they're crafting this type of legislation to take a more nuanced approach that fits specific areas as far as what job opportunities are there?
Thank you for your question. Yes, thank you for your question, Senator Wheeler. So I think there's a nuanced response, and it depends on the benefit. I think one of the largest cliff effects that you saw through our presentation and through research is childcare benefit cliff. I think the federal government has tried to ease some of the restrictions at the federal level and allow states to have a broader ability to be flexible to use child care benefits through the availability of these benefits through block grants. I think there are other flexibilities, and the federal government has set sort of baseline limits that states have the options of increasing the eligibility level for many benefits. And many of the benefits also provide opportunities to receive waivers for states to have more flexibility in administering the federal benefits. So I don't think I can answer your specific question now, and would be happy to look into how each benefit provides different amounts of flexibility to the state, if that would be helpful.
So brief follow-up, if I may, Mr. Chairman. Mm-hmm. So basically what you're saying is it depends on the program.
Yes.
Okay, and clearly all of these things are working in kind of concert with one another to provide different levels of security, which, and I understand that. I guess, what is the least flexible public assistance benefit that, out of all of the ones that we have discussed here today, as far as being able to transition people into work without forcing them into a very bad economic situation?
I'm not sure I have an answer for you right now, Senator Wheeler. I know that TANF has very restrictive limitations on when and how dollars can be used, and much of the direct cash assistance from TANF benefits has been moved across states into programs that support work. And so since it is a limited amount of money, and there are stricter limitations and guidelines, that would be one example potentially of a restrictive federal program. Those, again, states have flexibility of spending TANF dollars within buckets of, I guess, guidelines and opportunities for states to use them in different ways. So again, I think it just depends on the program and what sort of flexibilities you're looking at, if that's helpful.
It is. Thank you, Mr. Chairman.
Senator Howe.
Yeah, Heather, thank you for your time on this. And this may be a little bit out of the scope of what you look at and what you're doing. But has there ever been any discussion or research into kind of the psychological and emotional aspects of this, about having an increase of responsibilities and not getting kind of a dollar for dollar return on a sliding scale when there's phasing out benefits? Has there been any discussion or any studying done into the psychological side of this? I'm struggling with my question here a little bit, so.
Thank you, Co-Chair Houghton. Cameron, did you want to respond?
Yeah, I would say that probably goes a little bit beyond our purview. We do have a health team at NCSL that could probably collaborate with us in terms of that. And I guess, and thank you for the question. Were you referring to like maybe the incentive to go to work or accept a promotion, that kind of like mental, emotional sort of side of it, like the the desire to go to work or something along those lines?
Yeah, we talk about that there's cultural changes that have to be involved in some of this, and I hear that talked about a lot, and I've read some about it, but I've never seen anything where anybody's ever done any case studies on it. I was just kind of fishing a little bit.
Thank you. Co-Chair Howell, I do know of a study, I believe in 2021, the Urban Institute has an anecdotal study where they send tens of thousands of surveys to people accepting public benefits and ask about how they perceive their benefits and how they understand marginal tax rates related to their benefits. So I think there is some anecdotal evidence and insight into how people may perceive. I think one of the findings of that study is most people don't understand the complicated increases that accepting a new job could have, so they worry about any increase. I think another finding of that is they don't understand how, if their wage increases, how they may be eligible for refundable tax increases. So that's one example. And again, would be happy to look into additional studies that may have some of this anecdotal evidence that you're looking for.
Okay, thank you.
Senator Neal.
Thank you, Mr. Chairman. Thank you very much for the presentation. It's got my mind rolling around here just a minute on how complex this can be. So my question is, obviously you referenced a number of studies that have been undertaken. I was wondering if there's any study that sort of outlines a roadmap and or the playing field, so to speak, and the flashpoints that are experienced, and I'm asking a multiple question here, and also deal with options and alternatives that have been at least explored, or et cetera. So you have somewhat of an indication here in what you presented here today, but I'm trying to get a more comprehensive view and look at it. Does that help, or did I confuse you?
So let me try to answer your question, and please jump in if you have any follow-up questions or I'm misinterpreting. And thank you for your question. So a lot of studies have been done state by state, I think, to answer this. New Hampshire has recently passed legislation and a resolution to eradicate the cliff effect in New Hampshire, and has completed a final report about it. Ohio has also done work on this and has a report about it. New Mexico has reports. I think we've shared with you, or my colleague shared with you a little bit about Montana's work in this. So I think a lot of states have pieced together what works in their state. And so as far as, and I think this goes back a little bit to Senator Wheeler's question about where are the flexibilities at the federal level and the opportunities for states to then precisely identify policies and options that work for the populations you serve. And so there are examples that work in other states, and I'm not sure how they might relate to a roadmap for Kentucky.
If I may, Mr. Chairman. I think Senator Wheeler's question is what prompted me, actually. And I think your answer has revealed that there isn't such an animal. At least it seems to suggest that there has not been an analysis of these other circumstances and outcomes. There's no comprehensive analysis of that you're aware of. Is that correct?
Not that I am aware of. As I think my colleague Cameron mentioned, a lot of nonprofits and think tanks have been documenting and studying this issue. Notably, I think Urban Institute and Brookings have done a lot of work along this line, and may have some examples.
Thank you.
Yes.
Thank you very much. Thank you, Mr. Chairman.
Representative Weber.
All right. So I was, this question is for Mr. Rifkin. So I was looking at your presentation on page 16, and I was kind of debating here how to ask this question. So I'll just ask what's on my mind. so you have the Montana case study, and one of the let me preface this with one of the reasons that, or one of the goals I see of this task force is that we look at how we bridge that gap between an individual receiving benefits and being able to better themselves and improve their living situation. So we look down at the last point there, and it says Cassie SNAP benefits might be terminated. My question to you is this: at what point, or give me the trigger point when they no longer might be terminated, but they will be terminated, based on the information in this case study? Because that's really ultimately what we're going to have to decide on in this task force if we do make a recommendation. I don't know who makes the might decision, who makes the actual decision in this particular case, but can you give me some information that tells us when the trigger point is that these benefits will be terminated and they might not be terminated?
Sure. Yeah. Thank you for that question. So for SNAP, deductions decrease her net income to 100% of the federal poverty level. She will lose her SNAP benefits. Obviously, there were other expenses. We alluded to, she's going to have to pay out of pocket to maybe get health care, to maybe pay for additional childcare services. So that case study from Montana might not be, 100% complete, because they're not giving us examples of what that other babysitter might cost. Maybe she has a friend or relative or a neighbor who's willing to watch, and that's minimal cost versus, maybe a more established care service. For energy assistance, she is about $1,000, maybe $1,500 from losing energy assistance. So annually. So if she were to receive any other sort of child support, SSI, Social Security, supplemental Social Security income, any sort of another job, if she decides to take a part-time job, that would push her over the energy assistance threshold as well. Is that, if I didn't sufficiently answer, I'm very sorry. I can definitely look more into this. I'm very open to more follow-up questions.
No, that's helpful. I just, I've stated my reason for I wanted a little more clarification on what the trigger point would be. So anything that you do have that you can provide myself or members of the committee, I would certainly appreciate that too.
Sure. Yeah. And we do have information on the federal, I believe there was a question sort of alluding to it before in terms of flexibility. Many of the federal programs basically establish these thresholds at the federal poverty level. So, for example, for the benefits for WIC, women, infant, and children, that federal poverty level is set to allow states to set their benefits anywhere between 100% and 185% of the federal poverty level for WIC. And then for like free and reduced lunch benefits, that's also a sliding scale. It's 130% to 185%, that the federal government basically allows states to set the threshold anywhere between there. Some are a little more rigid. I believe SNAP has a firm line. I think it's around 130% of the federal poverty level. So we can definitely look more into those specific requirements for each one. I do believe some of it might be included in the additional resources, but we would be happy to, put a report together regarding that as well. Does that answer a little bit more? I don't want to get too off your question.
No, obviously. I appreciate it. Thank you, sir.
Of course. Thank you. We really appreciate it.
Representative Bray.
Thank you, Mr. Chairman. I guess I've got a question for Mr. Rifkin as well. So one of the things that kind of sticks out to me is, no two states are alike, obviously. But within, let's say, even here in Kentucky, no two cases are alike as well. I mean, you might have on one hand might be talking about a single mother. On another hand, might be talking about a single guy with a dependent elderly person at home. And so the qualifications for each of these programs seems to be different, whether it's SNAP or the child care assistance or TANF or LIHEAP. Can you talk about, and I'm looking at page 20, it looks like Colorado's implemented something to go across all counties and all of that. Can you kind of talk about that, what they've done, and has that simplified the process?
Absolutely. Yeah. Thank you for your question. That might fall a little bit under a bucket we sort of refer to as broad-based categorical eligibility, and we can definitely put some more reports and slides together regarding that. And it's basically states aligning their programs, similar to the Colorado model. And so in Colorado, those programs across include SNAP, Medicaid, and the state level Colorado Works. And so basically to increase access, they have integrated the eligibility and enrollment process for SNAP with eligibility criteria for the energy assistance. So it's basically lining up saying if you qualify for one of these, you automatically qualify for the others. Sometimes that's just the eligibility. Sometimes that's the application process itself. Sometimes that's both. Again, that kind of differs by state. We can definitely provide a more kind of illustrative example for kind of state by state. But that's sort of the model that they've gone off of, aligning SNAP and TANF, aligning SNAP and Medicaid to make it a little bit easier and to streamline the process and ultimately, I think, expand access.
Thank you.
Absolutely. Thank you.
I have a quick question here, and then we'll close out. So you'd mentioned earlier with the benefits cliff calculator, and I know there's some states using that across the nation. From a national view, how many states either have that implemented, are working on that, or is that part of this process? Because a comment you have just made, and then in the presentation, was that aligning those benefits or giving a resource for the people of those states to go and see where they stand and what they can do to make the correct move to move forward. So if you could just real quickly, how does that look across the nation as far as calculators and those being implemented?
Yeah, absolutely. Thank you for that question, Co-Chair. I don't know if Heather does. I don't know if I have that number exactly in front of me. I can say that from our research and kind of examining trends, it does seem to be more prevalent on the local level currently. We've seen stuff with large metropolitan areas, with Atlanta and some other larger cities creating benefits cliffs calculators. At a state level, I don't know the exact number. I do think there's a little less momentum at the moment, but we did see on one of those slides that states and policymakers are exploring benefits cliffs related topics and legislation in more frequency.
Well, thank you for the presentation. I appreciate you guys giving us that national perspective. The goal of this meeting is to gather this from a 10,000-foot view of what's going on, not only here, locally a little bit, but what's going on across the nation. So I really appreciate you guys presenting today and giving us all the information. And from your presentation, it sounds like we're right there with several other states that are diving into this issue and really looking for solutions. So thank you so much for presenting, and we appreciate it very much.
Thank you.
Thank you.
We really appreciate the opportunity.
So as we continue to move along, our second presentation will be from the Foundation for Government Accountability. Sam, if you are on, if you will introduce yourself and continue with your presentation.
All right, Chair Howell, Chair Dixon, members of the committee, thank you for the chance to present today. I appreciate especially the chance to present by Zoom. I'm up here in Maine, so this makes it very easy for me to talk with you all today. I appreciate that. So my name is Sam Adolphson. I'm the policy director at the Foundation for Government Accountability, or FGA. And FGA is a nonprofit, nonpartisan think tank, and we focus on promoting public policy that helps people move from government dependency to self-sufficiency. We want people to experience the American dream to its fullest. And just a little background on me. Before I joined FGA, I was the Chief Operating Officer at the Maine Department of Health and Human Services. And while I was there, I oversaw the Welfare Eligibility Office. So this issue that you're exploring, the benefits cliff, came up often in our policy conversations while I was in that role at DHHS. And that hasn't changed since I joined FGA. We work on welfare in 35 states and on the federal level in Washington, D.C. And that conversation about a welfare cliff comes up again and again. And so obviously it's an important issue. I really appreciate this committee looking into it really in a thoughtful way here over the summer. It's important because of its substantive implications. Like, what could be more important in welfare policy than a government created welfare cliff trapping people in long-term dependency? It's also important because there's a lot of misinformation about the cliff out there that really has gone uncorrected for a long time. And so today I want to cover 3 common myths about the welfare cliff. And then finally, it's important because an entire mindset has built up around the welfare cliff, and it leads folks to view welfare in kind of a backwards way. And so in short, there is a welfare pit, not a welfare cliff. There's not a cliff that welfare recipients are all standing on top of, about to tragically fall from if they start a new job or get another job. There's a gentle sloped hill. And at the top of that hill is a job and self-sufficiency. And I think every one of us on this call have walked up that hill. But policies have created and trapped welfare recipients in a pit at the bottom of that hill. And those policies keep making the pit deeper and deeper, which makes the hill look higher and higher from where they are. And then we say to them, to that welfare recipient, no, you shouldn't walk up that hill because it's too dangerous. So let's keep you safe down there. And I think it's important because this is one of kind of the fault lines in all the discussions about welfare. So I think we all agree that the day someone in our communities gets their first paycheck is a much better day than when they get their first welfare check. And I know we all agree that welfare should be designed as a temporary hand up for able-bodied adults, not a long-term handout to them. And we definitely all agree that the more welfare traps able-bodied adults in long-term dependency, the less able the programs are in serving their primary mission, which is helping the truly needy who can't work. So those, I believe, are some principles we can agree on. But there continues to be this conversation around the country that you all are having about this welfare cliff. So I'd like to share what we've learned looking at welfare programs and work around the country. First, it probably won't surprise any of you in the room that the best path from dependency to self-sufficiency is work. It's that simple. And there's a lot of studies that have been mentioned already. We've undertaken a number of studies that look at the impact of work requirements across multiple states. And just a few are Maine, where I'm at here, Florida, Kansas, Mississippi, Arkansas, Missouri. And what we looked at was what happened after work requirements were put in place in those states. And what we found universally was that, yes, people did leave welfare, they got jobs, and their incomes doubled or tripled within a year or two of leaving the program. Let me just emphasize that again. Their incomes doubled or tripled within a year or two of leaving the program. And these weren't surveys or samples. in the mail, we actually tracked the jobs data of every single person who left welfare. And I've provided some links to studies on this issue. And then I think you also have one there in front of you. But all of these reports are on our website, and we can provide them directly as well. So we know the solution to welfare dependency already. It's work, it's jobs. And the really good news is that there are more open jobs than ever before. So in Kentucky alone, I think you're all aware of this, but there are at least 180,000 open jobs today. And if it looks anything like it does around here, when you drive down the street, there are help wanted signs everywhere, practically on every business. But the kind of the misinformation that I mentioned about a welfare cliff, it persists, and it kind of keeps us worried about the clear solution that is these work requirements. So that brings me to the three most common myths about the welfare cliff. And let me just walk through these quickly. This is the first one, that most people on welfare are hovering right around the imagined cliff and avoiding earning one more dollar lest they suddenly plunge off this cliff. So really, that is the whole idea of the welfare cliff, that everyone is right up against the edge and they're throttling back work to avoid the cliff. And so that makes sense in theory, of course. And before I ever really got in to the details, running these programs and looking at these studies, I was worried about that too. But we've looked into this, and it turns out that it just isn't true. And really, it's not even close. The truth is that the vast majority of able-bodied adults on welfare programs are not working at all. And they're not close to losing benefits. The data shows that most aren't doing anything. The problem isn't that enrollees want to work more but can't. The problem is that enrollees are able to get away with not working at all. So I want to focus in on two major welfare programs with able-bodied adults in Kentucky. So the first is food stamps. There are about 550,000 people on food stamps in Kentucky. And according to the state's latest employment and training plan, 142,000 of those people are able-bodied adults that are getting the food stamp benefit. So we looked at data, and we just did this week. This is brand new, fresh data. We looked at data from the United States Department of Agriculture that oversees the SNAP food stamp program. And what we found was that for every one able-bodied adult between age 18 and 59 that was even remotely close to the eligibility cutoff, there were 1,600 that weren't working at all. And we define close to the eligibility cutoff as within 50%. So really, that's not even that close. So let me just repeat it. According to the USDA data publicly available, for every one able-bodied adult close to the income cutoff in Kentucky, there are 1,600 that are not working at all. So this is similar story in Medicaid as well, which is your other primary major welfare program in the state. Kentucky expanded Medicaid to able-bodied adults, and you all know what's happened there since. Just since the year 2000, you've added 1 million people to the Medicaid program. More than 600,000 of those are able-bodied adults that were added as part of Medicaid expansion. And we know from state data that we collected in Kentucky that more than half of those adults do not work at all, zero earned income. And we also know, I know labor force participation is part of the issue that you're looking into as a committee. Over that same time span, as we've seen welfare grow dramatically, Kentucky's labor force participation rate dropped by 11%. And you're currently one of the lowest in the nation for labor force participation. So in both of these programs, food stamps and Medicaid, most able-bodied adults are not at the edge of a cliff. They aren't working at all. It's a trap, a pit at the bottom, and not a cliff the way we typically think about it. So that's the first myth. The second myth about the welfare cliff is that people are worse off when they leave welfare. So I mentioned that when a welfare recipient is trapped, they're looking up at this sloping hill, not necessarily a cliff. And so here's what I meant by that. Of course, it's true that the complete suite or offering of government benefits can add up to a lot when you kind of combine all these various programs that we've heard about. And federal COVID policy, of course, with the extra federal unemployment benefits didn't help that dynamic. It made this offering very generous if you stay out of work. But the studies I referenced from Maine and Florida and Kansas and other states followed people after they left welfare. And in each case, those folks' income grew year over year. I should also say that on paper, this is really important to me, I think gets at an earlier question. On paper, $1 of government benefits might look equal to $1 that comes in a person's very first paycheck. But we all know that's not the case in real life. $1 earned is worth more than $1 received from a government benefit. And we saw from our Florida study that even people who went into modest jobs initially, like fast food, which pay pretty well these days, but even if they went into those lower paying jobs, that wasn't where it ended. They quickly moved on to higher wage jobs throughout the state in over 1,000 industries. The dollar in a paycheck grows with time and self-sufficiency. It's an investment, but the dollar in a welfare check is not. It doesn't operate that way. It's just a dollar. And, you know, this is really to say nothing of the dignity and the value that work creates, the new social relationships, people that can help that person, and the new skills that build towards those future and even better employment opportunities. And, you know, that's why 97% of full-time workers are above the poverty line. There's almost no poverty among people who work full-time. And it's also why having a job is a top predictor of whether someone with a criminal history will reoffend. And it's why work is one of the best predictors of recovery and lasting sobriety among individuals with substance abuse problems. These are benefits that the government can't provide, but they come with a job. It provides a safety net of people in the community, and welfare can't do that. And then third, and the final myth here about the welfare cliff is that the folks that kind of have pushed this welfare cliff idea the most kind of continue to evoke that one hypothetical person at the very edge of the cliff and say that once a recipient crosses the threshold of that income, there's nothing to help them, right? They're out there without a parachute, off the cliff, and we've abandoned them. But that's simply not true. So the policymakers, many like you across the country, over the previous decades, who are worried about this dynamic, have really already built an enormous number of rules and transitional benefits that essentially have eliminated these types of concerns altogether. So consider the food stamp program. And I know we've talked some about how it works already here, but Kentucky uses what you heard earlier is called the broad-based categorical eligibility option, state option in the food stamp program. And that does two things. It eliminates the asset test entirely, meaning that having $50,000 in cash, $100,000 in a stock account, a new RV in the garage, will not disqualify you from getting food stamps in Kentucky. It also increases the income eligibility level to 200% of the federal poverty level. So this means practically in Kentucky that a family of 3 is eligible for food stamps at about $46,000 in annual income. And the median household income, just for comparison, is about $52,000 in Kentucky. So from a starting point, the baseline eligibility levels for this massive welfare program are very high already. So you're starting from that point. And then on top of that, the food stamp program is really designed federally to adjust to earned income already. So benefits aren't static. They go up or down based on your income. And as your income starts going up, the benefits start coming down. It's basically connected, indexed together for this precise reason. The SNAP program, food stamps, also completely ignores the first 20% of your earned income. So you can get started without any impact to your benefit. And then once you get beyond that level, it starts ratcheting down. And there are also other deductions for child care costs and things like that. And then in Medicaid, there's a program designed specifically for people who move into work to give them the benefit after they've become ineligible and more self-sufficient. And it's called the Transitional Medicaid Assistance, TMA program. And it's offered in Kentucky to the parent caretaker group, one of your largest Medicaid groups. And it's for families who would otherwise lose Medicaid eligibility because of earned income or hours of employment. So those folks can receive at least 6 months and up to 12 months, a full year of Medicaid coverage, even after they're no longer income eligible. And then there's some other things that you're all aware of, I'm sure, like anyone leaving Medicaid because they earn income above that level, there's free or heavily subsidized plans on the healthcare marketplace, all the way up to 400% of the federal poverty level. And then just one final thought on Medicaid. This is the biggest program in your state, so it's very important. Since early 2020, back at the beginning of COVID, by federal law, not a single person has been removed from Medicaid because of their income. Not one person in America. So for more than 2 years, there's quite literally been no possible way for Cliff to impact anyone on Medicaid. So we've kind of run this giant Medicaid for all pilot in the country. And what have the results been? Are people rushing to work like never before? Like, now I won't lose my benefits, so I can go get that extra job. Has it solved that problem? It hasn't, of course. We have more people than ever sitting on the sidelines not working, despite over 2.5 years of not being able to take someone off Medicaid because of their income. So the solution isn't more welfare, it's more work. And I'd just like to wrap up here with how Kentucky can focus on that problem with a good solution. So the food stamp program is the primary place I think you have opportunity for reform right now. And the good news is that Kentucky can do this by better leveraging an existing program you already have called the SNAP Employment and Training, or E&T program. So right now, of the hundreds of thousands of able-bodied adults on food stamps in Kentucky, the state is serving just 485 of those adults statewide with this program that you're running currently. And so that's in large part because even though federal law allows you to make it mandatory for most able-bodied adults, Kentucky has chosen to operate the program on an entirely voluntary basis. I think with a mandatory E&T program, Kentucky could lift more folks up out of that pit, put them on the path to self-sufficiency, up that hill, and really help thousands of folks move from welfare to work more quickly through job training, coaching, work experience, and help with job placements around the state. And there's some real promise here too, according to Kentucky's ENT report from last December. A majority of the voluntary participants in the Northern Kentucky area, just as an example, were employed in the second quarter after exiting the program. So there's some real bright spots there to look at. So making ENT mandatory and then kind of seeing expanded participation and results, that's exactly the type of solution that can help achieve what I think everyone as part of this task force wants to see, which is people moving from welfare to work and from dependency to self-sufficiency. So with that, I'll wrap up, and I'm certainly happy to answer any questions.
Thank you, Sam. Is there any questions from any of the members? So, well, Sam, we appreciate your presentation so much. Thank you for being a part of our first meeting today. Like I said in the beginning, we have a very packed informational. We have one more presenter. And like I said, Sam, thank you so much. We appreciate it.
Thank you. I appreciate it.
Yep. We will continue to move along. We have a group, Dr. Cunningham, if you would approach, they are in person, and your colleagues, and introduce yourself and your colleagues from Kentucky Stats. Ms. Cunningham, you might want to turn your mic on, please.
How about now?
Oh, awesome. Thank you.
Great. Well, it's a privilege to be here with you this afternoon. I'm Jessica Cunningham. I'm the Executive Director at the Kentucky Center for Statistics. We house our Kentucky Longitudinal Data System and our Labor Market Information Office. We began some of this work back in 2018 in partnership with the Kentucky Workforce Innovation Board and the Cabinet for Health and Family Services to look at self-sustainability and benefit cliff analysis here in Kentucky. And so effective January 2019, we partnered with a national leader in this space. I believe the NCSL presenters mentioned this, the National Center for Children in Poverty. And in 2020, we released a tool called the Family Resource Simulator that we will talk about today. And so first, kind of what we'll start off with our presentation is we will define a couple terms that'll be pertinent to the presentation as we go through. We'll go over kind of a high-level view of the tool itself, that families can interact with this tool or be guided through this tool to find out their individualized situations in terms of self-sustainability and resources. And then we'll kind of, we've been asked several times in the past to kind of summarize some of the results in this tool. And as you can imagine, and we've discussed in earlier presenters, there are millions of different scenarios for families on a case-by-case basis, but we'll kind of go through some typical scenarios that we see here in Kentucky. And then we'll wrap up with any questions that you might have and provide a link to the tool so you can interact with it yourself. So I'm going to hand it off to my colleague here, Chris Stevens. He's a senior data scientist in our office, and he has actually become one of the state and national leaders in partnership with NCCP. He's worked closely with them to develop the Kentuckyized version of this tool that many other states have developed for the benefit cliff analysis in their state. So I'll hand it off to Chris to kind of go through some of the talking points.
Thank you very much. So benefit cliffs and sustainability, one of the things we wanted to do is cover some definitions. You've already heard a lot of these definitions. So work supports are just the programs that assist families. The benefit cliff, I think we've already talked about that. And then self-sustainability is going to happen when a family is no longer participating in any work supports outside of tax credits and has enough to meet all of their basic expenses. So in order to do this, you really just need two numbers. It's complicated, two numbers, but it's just two numbers. It's the family's expenses, how much they spend on healthcare and childcare and those kinds of things, and then the family's resources, how much money they have coming in from work, what they're getting in tax credits, and then what the value of the work supports, if they're participating in work supports, is. So in order to calculate those two numbers, the Family Resource Simulator needs a fair amount of information. There are 1.7 households in the state of Kentucky, which means there are 1.7 million, which means that there are 1.7 million different scenarios that we're all responsible for looking at in this situation. The first thing you need is county. So cost of living is different based on where you live. Then you need family size, number of adults, number of children, the family members' ages, how much you have in savings, whether or not you're getting child support, if the family has any debt. You have expenses like childcare and housing and transportation and medical health insurance. You have employment information, so what's your starting hourly wage? Do you work a traditional schedule? Do you work nights and weekends? Is there a premium for childcare at those points? Finally, in the tool, you can select which programs you want the family to be participating in that you're simulating. You can choose all of them, you can choose just one, and you can see what the results are for that family. After you've put in all that information, you get all of these things back, hopefully packaged better than this slide. So you get tax credits that the family is eligible for and the amount. You get the additional resources, including interest on savings, child support received, if the family's getting any disability benefits. You get expenses such as childcare, family food costs, transportation. You get taxes paid by the family based on income level. And then you get the amount of resource that they're getting from work supports or the reduction of expenses from work supports included in the tool. Finally, there's two really big things that you get, and these are the core pieces that we're looking at. And it's the amount of money that the family has earned and whether or not the family can meet their basic expenses, so their net resources after they've subtracted out all of their expenses. So this is the situation for Fayette County with 2 adults and 2 children. We updated all of these numbers to be accurate to policy decisions and handbooks and whatnot as of the 1st of June of this year. So this is 2022 data. You'll notice that with work supports, let me start at the beginning. Earned annual income is across the bottom on the x-axis. So you can see changes in income for the family, or you can pick out different families on the graph at earned income levels. You can see where that family falls. The left is net resources. You've seen a chart like this before in this meeting already. And then the dashed line across the middle is $0. That's where resources and benefits are equal, or resources and expenses are equal. You'll notice at about $35,000 and $36,000, the family is above the 0 line on the chart. With work supports, that family is self-sustaining. That family is self-sustaining again at $70,000 a year in earned income. And in between $35,000 and $70,000, that family will experience 5 different cliff effects. And at no time during that expanse will they be above 0 in terms of net resources. They'll have to scrounge and find new ways to meet their family's basic expenses. Also in the tool, you can look at what specific programs and what specific expenses are going into each calculation at each dollar amount. You can see where childcare, the cost of childcare increases due to a loss of CCAP. You can see where food prices increase due to having to cover school lunches and school meals and then loss of SNAP benefits. You can see the 2 cliffs of health insurance where adults are no longer eligible for Medicaid. You can also see where health insurance increases when the children are no longer eligible for Medicaid. Housing stays pretty stable in this scenario. And then you can see transportation increase as the family works. The adults in the family go to work more days of the week, so they have more days of transportation, so more cost. One of the things that we wanted to highlight is self-sustainability here. We took 6 families using census numbers and input from the Cabinet for Health and Family Services on the typical types of families that they're seeing enrolled in their programs. We have 1 adult and 2 adult families here with 1 to 3 children. The red line across the charts is the median household income for the state of Kentucky. Again, it's a little over $52,000 a year. You'll notice that the bottom number is the minimum amount that you need to make as the family, that the family would need to earn in order to be self-sustaining in at least one county in the state of Kentucky. Now, these numbers are different because of the cost of living that we've already talked about. The top number is the amount of money that the family would need to earn in a year in order to be self-sustaining in all 120 counties in the state of Kentucky. The one adult, one child family is the only family here that's represented that is self-sustaining at less than the median income. And families with 4 or 5 members will require more than the median income in order to be self-sustaining in any county in the state of Kentucky. This is a repeat of the chart that I showed you of Fayette County, but for these 6 different families across all 120 counties. One of the things that stands out is all families in these scenarios experience some sort of cliff effect at some point along the earnings line. The other thing, these 6 scenarios cover about 250,000 Kentucky families. That's 1 in 7 of Kentucky families being represented on these 6 charts across these income ranges. For those cliff effects that these families run into, 72% of those scenarios, it's due to a loss of SNAP benefits. 100% of the families experience a child care expense increase that qualifies as a cliff effect, and 100% of the families experience a cliff effect due to increases in healthcare expenses for healthcare insurance. We wanted to bring this home a little bit. So in Henderson County, a 1 adult, 2 child household, this family has $8,000 in additional resources above basic expenses while participating in work supports when earning $21.15 an hour. In order for them to be off work supports and maintain that same level of about $500 to $600 a month in additional resources above basic expenses, they would need a $10.10 raise. If the family got a raise, if the adult in the family only got a raise to $23, they would experience a $13,000 drop in net resources. Additionally, with Callaway County, in a situation with 2 adults and 2 children, the family, when earning $35,000 with work supports, is about $6,000 above zero. They have $6,000 in net resources above basic expenses. That family will experience 5 different cliff effects between there and $64,000, where they reach that point of about $6,000 above zero again. This family only drops below zero once, and it's by $30 at $45,000 a year. So the default values will fail to capture some nuance. Anywhere that a user doesn't input specific values for a family, we use national and local estimates. We get as granular as possible. If there's an estimate for a specific county, we use it. If not, we use a state estimate. If not a state estimate, we use a national estimate. The other thing, in all of the scenarios that we've shown today, we assume zero debt for these families. There's no medical debt, there's no car payments, there's no student loan debt, and no credit card debt. Changing any one of these things can change the scenario for any of the families that you're running the simulation on. And then coming back to self-sustainability, for a 2-person household, the minimum you need to be self-sustaining in the state of Kentucky is $45,000 with 1 adult and 1 child. For a 3-person household, it's $47,000. For a 4-person household, it's $57,000. And then in a 5-person household, you need at least $66,000 in order to be self-sustaining in 1 county in the state of Kentucky.
And so just to kind of close us out, we provided a link in your PowerPoint for the Family Resource Simulator so that, you can kind of input your own family scenarios in there. And I would like to reiterate Chris's point that, this is you get a more accurate estimate if it's an individualized interaction with the tool. Okay, so what we've provided here today are summaries of family scenarios that, make some assumptions in there of the zero debt. So just want to make that point again, and we'll open it up for questions.
Does any member have any questions? And I'll kind of open up. I have a quick question, not seeing any of the members right at this time. Question with the simulator, how many users can you track that? Do you know how many individuals have used this simulator or inputted their information to, throughout the state to kind of find out where they stand?
So that's a great question. So originally we built this tool within the NCCP site, but since then we have made our own Kentuckyized version that is actually live today. So as we work with the KWIB and such to get this tool out there, we'll be able to track those analytics.
Okay, so right now it's kind of unknown
Right.
on those. Is this simulator completely, can you customize it? And what I mean, it sounds like you've done that, greatly so far, but we can get down to individual county, and as an individual who would be on assistance in any particular county could go onto this simulator, input all of their correct information, and then be able to see the benchmarks that they would need to acquire to get off of assistance is what I'm trying to say.
Yes.
Yeah. Okay. And then one more follow, the analysis of Henderson, which is my home county, the 21 to what is called on here is 31.25 on the pay rate. That is, I would assume, not taking in that the employer providing that rate has benefits or anything that would take away, child care or insurance, anything of those sorts. Is that correct? That's kind of a cash basis across, supplementing these benefits, counting that they wouldn't counter with what would be offered with the employer.
So it does not account for if you worked for the Chris Stevens Corporation and I have my own nanny that plays with all the kids upstairs.
Right. Okay. So child care, the big issue, but does it take into account, health benefits and those things as if that $10, I guess my question to kind of narrow it down is the $10 is kind of saying that they do have health benefits at that employer or they do not, and this is what the difference would be.
So you can choose between a marketplace option or health and employer option, and then also there's a place for you to go in and put in how much you have to pay with your current employer, and it can calculate it based on the individual employer paying for those things. And you can also do that with childcare.
Okay, awesome. That's kind of the way I was steering that. Thank you so much. Does any of the other members have any questions? Senator Wheeler?
Sorry, Mr. Chairman. You mentioned that, you're running this with a zero debt scenario, which I think is probably a very false starting place for most people that are on public assistance. I think to some degree, a lot of times they're mired in debt, and it astonishes me regularly as a practicing attorney, where these predatory lenders and credit card companies will loan massive amounts of money to but they will make massive amounts of loans. Is probably the better way to describe that to people that I think we'll never be able to pay it back, and then they get caught in this interest cycle, which is really, really bad. So in that regard, how does your calculator factor that in as far as that's another factor I think that would have to be considered. And if you look at that debt service in connection with the increased wages, they could get hit with kind of a double whammy in my mind, because the more they make to service their debt, then it's going to, lower their eligibility for certain programs, which really doesn't improve their lot in any form or fashion. So, how does your simulator kind of address that scenario?
Yeah, that's a great question. So, we decided to provide this in the summary statistics that this was the bare minimum required. That's why we put the zero debt. And so we would be happy to run any summary scenarios that the committee would like to see with a certain amount of average debt or anything that the committee sees fit for that. But then also, you know, that's why we mentioned it's critical for individuals to interact or be guided through this tool so that they can put in their own individual debt scenarios so that it comes out with the best estimate.
Okay. Brief follow-up, if I may, Mr. Chairman. And I understand, and I guess you all are here more to explain the program maybe than to necessarily address policy concerns. But, and again, this may go to the question that I alluded to earlier in the first presentation. Have you all utilized this tool to see where we might make nuanced changes within some of these assistance programs to where and this may address a comment made earlier by Senator Howe too. I think there to some degree is a poverty of the mind in the sense that people do get trapped in a system and feel like they're being punished if they go out there and get a job and try to do the right thing, and that does affect somebody's psyche. Mm-hmm. I mean, would anybody? I mean, here I'm. There's also very much a dignity in work, and I think that those are two equally valid concepts. Have you all looked at which programs might be able to be reformed by the General Assembly with some nuance to account for the debt scenarios and to try to make this calculator work as we've talked about to transition people into self-sustaining careers?
So the charge of our office that was created through legislation is to really provide the data objectively, and we are not to advise necessarily policy. So what we can do is provide the data to you, and then the other thing that we can do is to lean into other state expertise that you heard from, like the NCSL, like the earned income tax credits and things like that other states are doing in these policy situations and these different programs.
Thank you, Mr. Chairman.
Co-Chair Howe.
Yeah, thank you. Thank you for your presentation today.
Mm-hmm.
I may be missing the boat on this, so just tell me if I am. In the slide that's up with the 6 family scenarios covering 250,000 families, how many total, do we know how many total families there are in Kentucky? What's that a representative percentage of total families?
There are 1.7 million families in the state of Kentucky, according to the United States Census latest numbers.
So is that 1.7 families that
1.7
million families that have children, or just total families?
Total families.
I should have asked my question better, shouldn't I?
So that's total families, and this covers 250,000 of those 1.7.
Okay, and is that 250,000 all of the households in Kentucky that have children?
That are 1 and 2 adult households with 1, 2, or 3 children.
Okay, but there aren't 1, 2, or 3 children, 1 or 2 adult households outside of that 250,000.
Correct.
Okay.
They would have no children or more than 3.
Okay, great, thanks.
Representative Dixon.
Yes, absolutely.
So Senator Wheeler brought up something. In 2020, the change was made in the state of Kentucky to move the SNAP benefit level from 135% to 200%. That's one of the reasons why you see so many cliff effects around $44,000. Those cliff effects were previously found at $30,000 and $31,000, and so it effectively pushed that cliff out to a higher income range, which meant a lot of lower income families were sustaining on work supports, as it were.
Thank you. Thanks for that report. Co-Chair Howe, the follow-up.
And I'm going to struggle asking this question, so be patient with me. So, in what you're talking about, basically, this moved the cliff gap up the economic chain, for lack of a better way, but the earnings chain a little bit. Is that something we're going to see as we evaluate different options as we go through this process of how that will either broaden or narrow that gap, move it up or down? Is that something that we should expect to see?
And it's something that we could simulate.
Okay, that was part
Yes.
B of my question. And if so, is that something that you could help us with along this path? If we have this idea and we want to get some estimates on real net effect, that you could plug different variables in this for what we're trying to do and then show us what the impact would be?
Yes.
Okay, thank you.
With that, are there any other members that have any questions? No? Good? Okay. Representative Bray?
Thank you, Mr. Chairman. Do we have data on how many families have fallen off the cliff?
The Kentucky Center for Statistics has recently integrated SNAP data into the Kentucky Longitudinal Data System, and we have UI employment data. So one of the things that we can do is we could look at, of SNAP recipients, what incomes look like over a time period, if asked.
And then just one follow-up. Do we have, so I assume then we have data on how many people are right next to the cliff as well?
We can look at the income. There are some of the nuances on things that are that are subtracted from income or added to income that may not be covered by UI employment, or we don't have childcare, like how much families are spending on childcare, which is subtracted from that number. But we could estimate, and I would use the word estimate in bold letters and a larger font.
So we could provide a list of the data sources that we have in our data system currently, and any of those things we could evaluate from the actual data in our system. But programs like Medicaid, some childcare, things like that, we don't have integrated into our system yet.
Well, do you have access to that data? Or have you all?
So Medicaid and childcare is within the Cabinet for Health and Family Services. So we would have to work with them to do that analysis and get that data.
Thank you.
Last question, Senator Nemus.
Yes, Mr. Chairman, if you would allow me, it's more of a statement than a question.
You may proceed.
First of all, I'd like to acknowledge Dr. Cunningham and her great work she has done. I was in the same cabinet, so thank you very much.
Thank you.
But on the benefit cliff, I would like to see if we can tear it down instead of being a cliff, tear it away. And then when a representative was talking about how many have fallen off the cliff, I would rather change that wording to how many people have become successful and not needed aid. Thank you.
Well, I want to take this time, Dr. Cunningham, thank you so much and your team for presenting. That was very informational. Take the time to thank all of the presenters and thank all of the members for your patience. This was a very long and informational beginning to our task force, and thank everyone in attendance. With that being said, our next task force meeting will be August 24th at 9 a.m. Here in room 131, and unless there is any other business or any other questions from the members, we will stand adjourned. Thank you.